of the issues is even for a self-funded employer, the data that you get from Blue Cross is not what a bidding carrier would like to see. For example,
full health profile, yeah.
For example, we don't get claims by the 3 products that you offer, which is odd. We just get a lump sum of claims monthly that's paid, but we don't know, this is from the $500 deductible plan, this is from the $1,000, and we really ought to be able to get that. We don't see claims by class. For example, we don't know how much your retirees under the plan are costing you compared to the active employees under the plan. And so sometimes it's a little bit of a stretch for a competing carrier to price the risk because they don't see as much as they would like to see. But being self-funded, you get way more than you had when you were fully insured, so that's a little bit better. But we're still going to throw it out there. You're a large employer. You know, a lot of carriers would like to have more of a presence in Kansas, and we looked at just the hospital network to see how it stacked up, and a couple carriers have really good networks out here, hospital-wise. We didn't break it out to doctor and pharmacy and all of that yet, but a couple of the carriers had a pretty nice matchup on the hospitals that are most used by the district right now. So we'll see how it breaks out, but we'll look at everything. We'll look at network, we'll look at wellness resources, we will look at disease management resources, we will look at the funding mechanisms. There's all kinds of hybrids off of self-funding versus fully insured. We'll look at it all and try to get real competitive proposals for you. And of course, we're going to look at the funding options to minimize taxes and fees. That's always a goal. So some ideas about impacting health. You're probably familiar with the fact that the district for many years, until about a year or 2 ago, I want to say, required a payroll deduction for folks who did not take the health risk assessment survey. The health risk assessment survey is provided by Blue Cross Blue Shield of Kansas. It's available. It's a questionnaire people take to answer confidentially questions about their health habits, their stress levels, just lifestyle things, confidentially to evaluate what their health risks are. We know from data that people who are aware of their health risks are more inclined to address them, and that helps ward off really large catastrophic claims when people are maintaining their health. When you had that premium incentive in place, you had probably about almost 100% participation. Honestly, it was in the 90% participation. So the aggregate health risk report that we would get was very valuable to the Wellness Committee and to the Insurance Committee because they would see what kind of health risks were present and they were able to address them through programs and communications and such. So we're recommending that we consider re-establishing that because just on a voluntary basis this past fall, people who wanted to take the health risk assessment that took it, only 303 people took it. That's 28% of the eligible participation. So without an incentive, folks are not really getting engaged with that and they're not looking at their health risks. But we do know of that 303 employees that took it, 25% of that group had 3 or more health risks. So we really need to see who the high risk, not see who the high risks are, but see how many high risk participants we have, what are the risks, and get some programs and activities and resources out to folks to help them maintain their health. This is not a very big database, but I wanted to share this with you. We have 2 clients, larger clients, and the details of this are on the next page. But we've got 2 clients who paid a data repository, University of Michigan will do this service, to tie the health risks from the health risk assessment to the actual paid claims of those participants and deliver back a confidential report that just shows what are my claims annually for folks who took the HRA versus those who did not. Because there are big studies that indicate that there are higher claims for folks who don't take the health risk assessment versus those who do. These particular employers wanted to see in their own population how that worked out. And so the one has done it 3 years, the other for 2. The first group had an average savings of $582 annually. Not savings. They had the people who did not do the HRA had higher claims of almost $600 annually in the 3-year period we looked at, and the other client had $502 higher claims for the people who did not take their HRA. And you could say perhaps the people who don't want to take a health risk assessment don't really want to address their health issues. They have a little bit higher claims. The next is from a much larger database. 1,300 companies with 17 million employees in 2013. It just shows the relationship of the value of an incentive to reduced claims. And it shows for health risk assessment, biometrics, and telephonic coaching. The blue bar represents what the value of the incentive was in each case. The first one, $265 in value of an annual incentive for a health risk assessment. That employer, or those employers, saw more than 2% reduction in their claims. Just to kind of give you a little bit of the data behind the rationale for encouraging folks to do the health risk assessment. The next slide is kind of, obvious. If you just give people t-shirts and water bottles, you're going to get low participation. If you reward with a premium reduction or something more meaningful, the idea is something that is repeated is more effective than a once-a-year giveaway or a prize or something like that. So, more on impacting health. We just think that more education. You have a really big wellness committee. Their names are at the end of this presentation. You've got a lot of folks at the buildings, boots on the ground. They're trying to get people to pay attention to their health risks, and that's great. So more education that those folks can have to encourage activity is probably the number one thing anybody can do to improve their health. And continue to work with Blue Cross's disease management. They're building up their resources and communicate what they come up with. Melinda said just a couple weeks ago she had the Blue Cross case management nurses around to the buildings who welcome them around lunchtime to share that information. So we'll try to find more effective ways of getting time in with the teachers and the staff. It's not easy. Not a lot of people can make time in their day, but so part of what we're going to do, and I say we, but really it's KJ and Melinda, are going to deliver this presentation to the folks. In the insurance committee meeting, we asked if there were additional rumors or different additional concerns they were aware of that we might add. And I think this is pretty comprehensive based on what that group thinks. But some of the rumors, and part of it comes from the meeting we had in October, where we looked at the alternatives from Blue Cross and those really high out-of-pockets, and that was concerning to folks. Or eliminating the $500 deductible plan is concerning to folks. That's a nice benefit. So we wanted to address the rumors and take questions face-to-face best we could. So the first one would be, if we're not able to keep the same plan features we have now, we might have to have more out-of-pocket costs. Blue Cross Blue Shield may no longer be our carrier. We've had them for a really long time. We might not be able to have them anymore. Maybe the district won't pay 100% of one of the options for me anymore. That's a concern. I'd be better off if I just went out to the federal exchange, to the marketplace to buy my coverage, or I'm going to have to prove I'm in good health, or I'm going to have to pay more for my coverage. So those are some of the rumors, and there's a reason for these rumors. I want to clarify the truth about being able to keep the same level of benefit, that the insurance committee will be evaluating different options. The insurance committee will be looking at different options, higher deductibles, out-of-pocket costs. If you lose grandfathered status, they're going to do their best to evaluate what creates a hardship for families where the benefit's not all that valuable versus the cost savings that might be present with different options. It is true that if you lose grandfathered status in 2015, if you have an office visit copay, if that's one of the things that you decide to add onto your plan, and prescription drug copays now have to go towards out-of-pocket maximums. That's a great thing for participants, but it does increase the costs associated with the plans. Today, an office visit copay does not go towards your out-of-pocket, whether it's for prescription drugs or office visits or anything else. Blue Cross and Blue Shield will no longer be our carrier. It's been several years since we've gone to the market. We're going to do a full analysis and wouldn't make any changes unless it was for the benefit of participants in the district. Just address the fact that that's going to happen. It doesn't mean we're leaving Blue Cross. It just means we're looking at alternatives. For folks who think that it might be better off for them to go to the marketplace or the exchange, everybody can purchase coverage through the marketplace or the exchange if they chose to. You can purchase outside of the exchange. You could go to a carrier and get an individual policy for yourself or for your family, or you could get coverage from the district if you're eligible. It's a matter of whether you're eligible for a subsidy or not. And because families or because employees are eligible for a plan here that meets minimum value targets, has minimum essential coverage, and passes the affordability standards, then the family would not be eligible for a subsidy. And I don't think a lot of people understand that, and they may understand it by now. They may have been out on the marketplace applying for coverage. They have till March 31st to do that. But just to let folks know that that is an option for them if they wanted to pursue it. But because of the generous benefits here at the district, they would not be eligible for a subsidy, nor would their family members. And then the other, about having to pay more based on your health conditions. There are so many laws, of course, that protect people and their health information. The Affordable Care Act, HIPAA, Americans with Disability Act, there's so many. Nobody would have access to their confidential information. But just to make sure that folks understand that the incentive is awarded for participation, not for results. Doesn't matter about your high blood pressure, whatever you have, it's a participation award, it's not a results award. There are such things as employers rewarding outcomes and body mass index and all of that, but that's not what we're talking about here. And then just to give credit to the insurance committee members that listened to us talk for almost 2 hours earlier today, and the numerous wellness committee members. They also work with outsiders from the YMCA, Garden City Rec, Healthier Generation representatives, and so a lot of community support, and they have the power to do a lot of good things. I would just hope we could get them some meaningful data so that they were not shooting in the dark. They knew what health conditions were out there and what they were trying to accomplish. Anybody have any questions for me about this or the supplemental piece that was more the nuts and bolts of healthcare reform, just as a little background for you? Anything for me?
Any other questions?
Are you getting from the committee, insurance committee, that what the pulse is with regards to the employee willing to participate in the cost of coverage?
Actually, some of the comments have been, because they hear of other employers with, really high deductibles and high cost sharing with the employees, they're like, gosh, if I had the option of having a plan that demanded a high out-of-pocket cost for me versus a payroll deduction, I think I'd probably rather have the payroll deduction. We're talking about maybe surveying the employees. It's hard to ask that, because of course everybody's gonna want to keep what they have. But to try to get a sense of, in the population of, if you had an opportunity to have a payroll deduction to keep the benefits you have, would that be preferred over continuing to have 100% paid for policy that perhaps required a little bit more out of pocket as you use the plan, just to try to get a sense of where people fall that way? Choice is good, to keep what you have right now and just say, this plan will cost you a deduction if you want the $500 deductible. And my gut tells me that a lot of people would appreciate being able to continue down that path. But, it's a matter of how much impact is that going to have on the district's overall costs if you're taking $20 a month. It depends on what you're taking.
Exactly, and overall district's budget. I mean, it's going to affect salaries if we get to that. So it's, we have one pot.
Yeah.
So I'm glad that your committee's thinking that way, whether or not you've agreed to survey or not. Again, with regards to your committee, do you feel that there's, I guess, lack of a better word, appreciation for the high deductible health plan and a health savings account? Do you feel like the people that you get to talk to on a regular basis get the benefit if they happen to be a healthy family?
I don't get the sense that it's appreciated for what it is. And even in the committee today, there wasn't a common understanding of how it worked.
Is it an ignorance issue, or is it a fear issue, or is it a consumer, utilization issue? Because that is something to celebrate. I mean, that gives you so much power. Given if you're a healthy employee, with low risk, no one knows what's going to happen in the next, 12 months that you commit to a plan. But if you generally are healthy and you don't have a lot of, maintenance medications, it's so smart for these young new teachers that we have to be able to bank some of that money, let it grow, and that way if you did have something, broke your ankle or something, you'd have that money built up that you could use all at once.
And the district's putting $600 a year for a single employee in that plan, And so, you know, if you get lucky and you don't use that 1 year, it rolls over, then before you know it, you got 1,200, that's almost half your deductible. And for that year, when you break your ankle, you've got a cushion there. But I don't know if it's been access to folks or,
My personal opinion is I think we have two things working against us. I think that it's too easy for someone to say, I don't have to think about it because the district will pay for that nice, pretty policy for me so that I'm covered for everything and I don't have to think about it. I also think that I get the sense, because we have had such a rich plan for so long and they're so accustomed to having these rich benefits, they don't want to lose those, which I completely understand. But to me, insurance is also, it's the same thing you do when you go buy your car insurance. You have to weigh the risks. Do I want a $500 deductible or do I need a $250 because I don't have any money to, you know. But you take a risk, and insurance is not necessarily, in my opinion, designed to cover everything. I mean, you have to take a little risk here and there, and where is everyone's risk tolerance level? They've had the ability to have the tolerance level real low, and unfortunately, because of where we're at with budgets and everything else, we have to shift the plates a little bit and find out where that comfort level is. And I think that a survey will be very helpful, and that's kind of what we try to encourage the insurance committee today, and we've asked for Janet's help in gearing some of those questions, because you're right, we have one pool of money. What do you want us to do with it? We need guidance on how would you like this plan designed and what's it worth to you. So I think that there's lots of things that we can do. Any of these pieces, all of these pieces, come up with our own design. It was interesting to me, and I hope to have it out soon, but when we put together the pieces of like what the city is doing and what the college is doing and how their total out-of-pockets compared to what the employees are putting in, I think that's very telling that we might have to do something different. I don't know how drastic that is, but that's where that shift of place will tell us, that survey will tell us what's it worth to the employees, what are they willing to give up to be able to have what they want with what we have available.
What's your time frame on the presentation?
We start them this week. We wanted to present to you and the insurance committee first because we knew there's so much out in the rumor mill, and we wanted you to be armed with answers to any questions you might have. We wanted the insurance committee to be prepared, but we have a meeting with the ESC this week. We've started scheduling the building visits next week. I mean, I think we go out. My anticipation is this could take us a month to get through all the buildings, just because we have to go either real early in the morning or in the afternoon. Most I can do is 2 in a day, just depending on schedules. So.
And are you planning the survey following the presentation after the information's been presented to them?
That's what I would anticipate, that's what the insurance committee will want to do, is once we get all the information out there, because I do think that a lot of the people don't understand even that we're self-funded, or what that means, which is why we wanted that component in there as well. It's just like balancing your home budget. You know, you make choices. So if we get the information out, they have a chance to process, ask questions, and then hopefully visit with their wellness committee people, their insurance committee people, and ask good questions, answer good questions. Then maybe we'll have some time to figure out from the results of that survey what we do going forward once we have the information from the
survey?
well, from the survey, and then from the sending it out for bids and getting those. Because we're just trying to get ahead of the game with negotiations, the timing of negotiations, the timing of we don't get our renewal till August, September timeframe. There's just so many moving pieces that I feel like we have to have more information to make decisions now, even though what we have, we won't know information till later.
Would there be, realizing it's creating more work for you, your staff, would there be an advantage to surveying the buildings within a 2-week period of completing your presentation at that building? In other words, you're doing your surveys for building by building, and my thought process is that way the information you presented is more fresh on their mind. There's a period where they've had time to follow up, process, ask questions, but rather than 30, 45 days later, now we send out a survey, and the first building's
moved on,
Yeah,
absolutely.
they've already forgot.
We had thought about that, but I think that's a good idea. We just got a little bit more here on how we are gonna do that survey and the questions that we're gonna ask. We can definitely address that sooner.
Yeah, we'll try to keep
I
that
think
short
that's a good
gap,
idea.
so people are remembering all the components.
I think we'll get a better understanding of what the personnel really want to do.
Okay, we'll definitely do that.
I'm one of seven, but my opinion is very strong, and I'm very glad to hear, KJ, where you're coming from, because I think you're spot on how we need to look at this, but this needs to be looked at as a consumer. This needs to be looked at like you are looking at this on the shopping shelf. Do I want brand A, brand B, even though this costs this much and this costs something else? And let you decide what goes in the cart, and let you decide if you're gonna go to the doctor, if you wanna bank some money in your health savings account or not. But I think that ownership and being vested as a consumer in healthcare is a shift that the whole country is going towards, and it requires a lot of education, a lot of it. And so every time you talk, your audience is gonna hear more of what you're trying to say. But you're definitely going in the right direction, in my opinion, by educating your staff on where we are, but really where we need to go, where we can't afford to stay.
Any other questions?
I just had a question, and it seems to me that the health insurance is a big factor when we go out and seek new employees or try to recruit from other areas. So I think having some comparisons both across Kansas at similar size districts as well as locally for those people who live here would be helpful, because I think we need to have that balance between what's competitive when we're recruiting and what our responsibility is to the taxpayers to use our funds wisely. So I think the more information that we can get, the better decisions that we'll be able to make. But I think it's broader than maybe you would otherwise see in a big city, and really just competing for employees in that city, so.
Well, it was definitely interesting, and it's not in front of you, but when I compared, what other school districts were doing, it was very common that there was at least one option that was completely funded on the single plan. So that definitely is a recruiting tool that we want to keep in place and not price ourselves out of the market because other districts are doing that and we're not. So I think that will definitely be looked at. But I also noticed that there were, that $500,000 plan that we have was very rich compared to others. So I think as long as we stay competitive in that market, if not a little better, because we always want to be a little better, that'll still keep us there, absolutely. I don't think it's our intention to take that away by any means.
The other issue is that you subsidize more of the family dependent costs here than those other employers that we looked at, and that's definitely true. In, Kansas City Metro, the school districts there, they concentrate on the employee costs and very little or nothing, honestly, towards the dependent tiers, and you're very generous towards the families here as well.
And that's above and beyond industry standards, is what you're saying, that this district does.
I think so. That
Yeah.
bears out with the school districts we work with and with the local employers and school districts that KJ identified.
Well, I contact some employers every time I look and shop, and I shop every year just for due diligence, but, it's very common for an employer to, like KJ said, to cover the $1,500 deductible premium for an employee only. But if the employee wants the $1,000 deductible, they pay the difference. And if they want the $500 deductible, they pay even more.
Yeah.
And that's what I'm finding, just by spot checking major employers in this community, obviously not a school district, but to me, that's leaps and bounds different from what we're doing now. We have so much room to adapt to increase healthcare costs within our district, in my opinion.
I think so too.
But we also really upset the apple cart when you do that.
Right, and I'm glad Jean said that, because as soon as Jean said what she said about recruiting, I can hear Dr. Carlin, because I've heard it before. This is a great tool for me when I recruit, you know, to be able to say this is one of our benefits, and they look at you like, are you serious? But, yeah, you gotta weigh it all.
This is a critical issue facing the district and facing all of our employees. It's been alluded to that KJ will be going out to the various schools and present this information to every school. But they're going beyond the schools. They'll go to our bus drivers, they'll go to our custodians, our buildings and grounds, and nutrition, so on and so forth. Every employee will hear this presentation and have an opportunity to give back information regarding this topic, because it doesn't matter who you are in this district, this issue faces them. This is not just a district issue, this is a national issue facing this country. Healthcare is a major issue. Somehow, we've got to get our employees' attention of how important this is. No longer can our employee be laissez-faire about healthcare in our school district or in any school district. We need to work toward a meaningful solution that we can afford and protect and provide this service and this benefit to our employees and their families. 10% of the budget. Exactly right. If you looked at those numbers up there, healthcare is about 10%. A little more, as we move forward, it will be more than 10% of our budget. Good point.
I don't think there's a laissez-faire attitude by the teacher, at least the teachers. I haven't talked to everybody in the school district, obviously, with regard to healthcare. I think there is a concerted effort to be cognizant of what the options are and what to be doing. And this was a few years ago, but I know one teacher chided my husband because we went to the emergency room with my son. I wasn't using the school district policy at the time. And she's like, why would you consider doing that? Because, you know, your cost for insurance and all this kind of thing. Like and you know, at that time, you know, my attitude was I have insurance. If my child is sick, I'm going to use it. You know, so I don't think there's that. I think people want to be active and engaged in this. They want to know what their options are. And, you know, I know one of my tough decisions in going to private practice was, do I want to give up my even richer insurance plan that the county has? One example was I was in the hospital for a week when I was on the county plan, and I paid nothing out of pocket for that week. I was in the hospital overnight on the school district plan and paid over $1,000 for that one night. So we're not necessarily the richest game in town, I guess is one of my points. There is another plan out there that if some of our teachers or other personnel want to use, it's there. But I just want to, I take issue with the laissez-faire comment, I'm sorry. But I think they're wanting to be involved and they want to know what's going on and they're trying to make the best decisions that they can. And I don't think they're just going out to use it just to be using it. They're using it when they absolutely have to.
And I concur with that. I think they use it when they need to use it, and they should use it. That's what it's for, when they need it. What I'm saying is I think people need to get involved here with the issue at hand. And our teachers, bless their heart, they're in this profession to teach kids. That's where their heart is, and that's what they're doing. So that's kind of how I'm referring to it as laissez-faire. They're spending their time teaching kids, preparing lesson plans, and insurance isn't a top priority to them until they need it. Is kind of what I meant to clarify.
Okay.
Anything else?
Mr. Chairman, I'm really happy for the health of the school district. It's just a tremendous service and very informative. I know the committee gets a lot of benefit from your expertise, so I'm just happy we're working
report, so I'm really appreciative to be here, thank you.
KJ, Linda, Janet, thank you very much for your efforts. Some policy revisions we discussed, please.
Yes, you have a couple of policies before you. Actually, you've had about 15 of them before you this year and to revise. And golly, I thought we were caught up. And so Joanne gave me the sad news. The KSB sent us 15 more, 12 to 15 more to look at. And then this fall, this summer, they're going to send us about that many more. So I'm not sure we're going to catch up anytime soon, but we'll keep working at it. But you have two policies before you this evening. One, a new policy, GANA, expense reimbursement of credit cards. This policy was proposed by KSB, as all of our policies, and this one really reflects the practice that we follow in the district in handling credit cards. So look at it as a new policy. Don't hesitate to call me and ask any questions that you have regarding it, or call KJ, because she actually puts this into place in the way her department handles these credit cards as they work with Commerce Bank. I believe it's Commerce Bank. Okay, the second policy is IIBGA, Children's Internet Protection Act. This is a revision to the current policy. Probably relatively minor revisions until you get down to the last paragraph, and it reads, if the district is providing public access to any computer, the CIPA or the Children's Internet Protection Act plan shall also implement and enforce technology protection measures to ensure no minor has access to visual depictions that are child pornography, harmful to minors, or obscene. That's the new statement in that policy. We're not asking for action tonight. This is a first reading. Again, don't hesitate to call with any questions. We'll be glad to clarify anything in this policy. If I don't hear from you, as usual, then I'll be on the consent agenda for approval March 3rd.
Questions for Rick or KJ? Okay, thank you, Rick. Open discussion. Rick?
March 13th, which is a Thursday, is the chamber banquet. It is being held at the college. We have not, we normally, in the last couple of years, since the chamber held their banquet at the new high school, we just received a complimentary table because we didn't charge them for the use of facility other than the expenses that the district incurred. So they provided us a table. I haven't reserved a table as of yet, so I'd kind of like to know your feeling on that. So because we can reserve a table, but there will be a cost to it as there normally is. But we've done that most every year I've been in the district. And as I said, the last couple of years, we kind of got a freebie, but not necessarily so. We got to, it's not free to use our new high school. But it was a good public relations thing to get people in the community and learn the school.
Can I just, short tail on that, Dr. A, the speaker, which is what got my attention, for this banquet is Terry Spalding, which I've never heard of, but, I guess he's a New York Times bestselling author of It's Not Just Who You Know. I haven't read the book, but it's kind of an interesting title. And it's, the subject matter is how to take colleagues and business contacts and develop lasting relationships with those people. So, I don't know, it kind of got my attention that we can all kind of benefit from that. It sounds like a pretty dynamic speaker, so that's why I brought it up.
Does anyone here tonight have any interest or is planning on attending?
I think I may, but I also have alternative methods of attending these, so.
I'm in the same situation Jean's in.
And that's what we've run into.
I think
I'm in Muskogee, Oklahoma, so I'm going.
Couldn't believe I being tabled up.
I've already purchased
flexible. I haven't, I plan to attend, but I can attend in multiple ways.
I say we save them up districts and not get a table.
Well, I would encourage maybe the district administrators to consider using that. So some of the district personnel, I think it might be a very good speech, and we don't often get people, in our area. So without having to drive to go see somebody, listen.
I think it's appropriate to facilitate their attendance, so.
Sorry, guys. We're having car issues.
If you would consider that, Mr. President, I think it would be appropriate to cover the costs of district administrators attending. Now, if that's a table, I don't know, but
That can be handled at your level, at the table, for the district administrators.
We can check if there is interest or people.
Yeah.
We can probably.
We still open discussion?
Yeah, you were scheduled for testimony, according, and apparently they canceled it.
Yes, there was a superintendent's roundtable scheduled for last Thursday afternoon at 1:00, and they invited a number of 5 or 6 superintendents that utilized a lot of the at-risk funding, and our district qualifies for a significant dollar amount there, probably in excess of $9 million. $9 million of our $90 million in funding is at risk, and we use a large portion of that for funding all-day kindergarten as well as other programs. It's based upon our free and reduced lunch count, and we have about 58-59% of our kids qualify for free lunch. Another 12-13% qualify for reduced lunch. So I don't know what this education committee was looking at here, but I think they wanted to know how we were spending our money and how much we valued it. And we would have been there to answer any questions that they would have had for us. The meeting got canceled, and it's my understanding it will be rescheduled. So it's rescheduled. I'm glad to attend and represent the district because that at-risk funding is critical to us being able to fund our MTSS program, individualize our instruction for our kids that fall behind in a variety of skills. We just can't lose it, and we're already losing and have lost every year federal monies, Title I monies. We will give them our best thinking, and I know Shawnee Mission is going to be there, Wichita, and Topeka, and Liberal. There's going to be so there's a couple of school districts from Southwest Kansas.
Laura and Steve were able to attend the legislative comments beyond what we read in the paper.
I think like I got in the paper, something else.
There's an autograph line forming outside.
That's exactly what it is.
I thought it was a really good discussion. There was a question about Common Core that was brought up. And after that, I also ended up in the middle of a Facebook conversation about Common Core as well, because we had a frustrated parent at Jenny Barker. And I just want to say to anyone who has questions about Common Core to please come and talk to our administration, talk to one of the board members. There's a lot of misinformation out there. I know some of us have, may have made the offhand remark, well, you're listening to too much of that stuff. Someone told me you're listening to too much of your administration. I'm like, well, okay, but I'm the one who, I'm putting out the facts here on this conversation, and we're not getting facts on this side, at least at this point. So please talk to people. If if you have questions about Common Core. I know I spent probably about 15, 20 minutes with one individual after the coffee, as did Steve, talking about different aspects of the Common Core, which was something I was going to mention as well during the open discussion. But I did appreciate the comments from Representatives Dahl, Hyman, and Jennings. The comment that Senator Powell made, and he was in attendance on Saturday, was that, I believe the quote was, he has a lot of smart people telling him that getting rid of the Common Core is the right thing to do. So,
So,
if it goes to the Senate, I'm assuming he's going to be voting no for the Common Core. Because he has some smart people telling him that's what he should do.
yeah, and it's noteworthy, there's a bill, of course.
Yes.
And I don't know what our role should be in that, but it's tempting to jump into the, for what it's worth, testimonial, long line of testimony against that bill. But that, and I'm sorry I don't have the bill reference in front of me, but that bill specifically to, as I understand it, do two things. To unfund implementation of Common Core, something to that effect, but also to sort of change or block or start over certain standards that the Kansas Board of Education has already done.
It's House Bill 2621,
House Bill 26.
and it would null and void basically Common Core plus the next gen science standards, and there's some character ed standards that would also be wiped out, and it would make it subject to a committee appointed by a variety of people, including the governor and the legislature and the state board.
Well, something that Representative Jennings said that I really appreciated is, if not Common Core, what else? He's said, I'm not listening anymore to the people who are just saying no, no, no.